Hello again. With me today in this rather dreary day in the courtyard at St. John's College, Cambridge. With me today is Dr. Anthony Yeung. Dr. Yeung is a noted expert in spinal surgery from Phoenix, Arizona. Tony, tell me, you've heard a couple of days of meetings now. What's your overall impression about where the trend of spinal surgery is going?
Definitely, no doubt in my mind. The next 5 years, minimally invasive anything is the key. The public demands it. We have the capability of doing it. All traditional surgeries are going to be looked at in a little different light because of minimally invasive techniques. The fact that the end of the Cold War, we have technology that we never had before in medicine. For instance, we can probably have a surgical simulator to teach surgeons how to do this type of minimally invasive procedure without having to have their learning curve on a patient.
Looking out over the horizon, where do you see yourself and your practice going over the next 5, 10 years?
I see my practice already I started as a general orthopedist. Now I'm 90% minimally invasive spine. Not because that I'm interested in it, but really because my patients demand it. I have enough volume that I don't have time to do all the other things I enjoy. That's good and that's bad. But it's good that it's something that I really believe in, and I think it's going to continue to develop.
One of the things that we've appreciated about minimally invasive spinal surgery is that, at the very least, it preserves your options for the future. You can always do an additional procedure if necessary, but hopefully the primary procedure will be curative. Is that your impression as well?
You know, when I graduated from medical school, we took the Hippocratic Oath. And you know what that says? Relieve suffering, do no harm. This is it. All the things that, as surgeons, that we normally do, we're hesitant and we're very conservative. Why? Is because while we help some people, what we do is paradoxical. We also make them worse in other ways. Now we have the ability to really relieve pain, and at worst, if we are good at what we're doing, the worst that can happen is we can't cure them, but we still have a chance to relieve suffering.
Tony, I couldn't agree with you more. Thank you so very much for being with us today. Thank you.
Thank you, Lawrence. My pleasure.